You wake up suddenly in the middle of the night, heart racing, breath caught in your chest. Your calf muscle is locked so tightly it feels like a rock-hard knot beneath your skin. The pain is sharp, intense, and overwhelming. You instinctively grab your leg, hoping pressure will force it to release. But it doesn't. You try to straighten your leg, but the muscle refuses to cooperate. It's frozen in place. Tears well up in your eyes as the seconds stretch into agonizing minutes. Your spouse asks what's wrong, but you can barely speak through the pain. This isn't the first time it's happened, and deep down, you're afraid it won't be the last. As a urologist, I hear this exact story from patients over 60 all the time. And the most heartbreaking part is that many of them believe this is just something they must accept with age. They think painful nighttime leg cramps are inevitable. But that simply isn't true. What if I told you that in as little as 2 nights, these painful cramps could dramatically improve, or even stop altogether? What if a simple drink, one that takes less than 2 minutes to prepare, could help your muscles finally relax so you can sleep through the night? Stay with me, because I'm going to explain exactly why these cramps happen, what's going wrong inside your body, and how you can begin fixing it starting tonight. Here's a medical fact that surprises most people. Nearly 75% of adults over 60 are deficient in one critical mineral required for muscle relaxation. This isn't rare. Researchers actually refer to it as a silent epidemic. And the shocking part is that most routine blood tests don't even look for it. That means you could be suffering for months or even years without anyone identifying the real cause. When this mineral is low, your muscle fibers lose their ability to relax. They contract, and then they get stuck. That's when cramps strike, often right when you're trying to sleep. The pain isn't imaginary, and it isn't psychological. It's chemical. Let me explain what's happening in simple terms. Muscle movement depends on a delicate balance between contraction and relaxation. When you move your leg, calcium enters your muscle cells and causes them to contract. That part works just fine. But for the muscle to relax again, you need magnesium. Magnesium is the off switch. Without enough of it, the muscle can't release. Think of calcium as turning a light on and magnesium as turning it off. When magnesium is low, the switch is broken. The light stays on. The muscle stays contracted. No amount of rubbing, stretching, or massaging can fix that because the problem isn't mechanical, it's biochemical. This problem becomes much worse after 60. As we age, our digestive systems absorb minerals less efficiently. Stomach acid decreases, which is necessary for proper mineral absorption. The intestinal lining changes. Even if you eat magnesium-rich foods, absorption can drop by 30 to 40%. On top of that, many medications commonly prescribed to seniors actively deplete magnesium. Diuretics, often used for blood pressure or heart conditions, flush magnesium out through urine. Acid reflux medications reduce stomach acid, blocking absorption. Diabetes medications like metformin lower magnesium levels as well. So you're absorbing less and losing more at the same time. It's a perfect storm. That's why nighttime leg cramps affect up to 60% of adults over 60. And no, this is not your fault. Now let me tell you the drink that addresses the root cause. This isn't just taking any magnesium supplement. The form, the dose, and the timing matter enormously. You'll need magnesium citrate powder, not magnesium oxide. Magnesium oxide is cheap, but it's absorbed at only about 4%. That means most of it goes straight through you. Magnesium citrate is absorbed at closer to 30%, which makes it far more effective for muscle relaxation. You'll use approximately 300 milligrams. Next, you'll need 8 ounces of room temperature water. Not cold, not hot. Temperature matters. Cold water slows dissolution. Hot water can degrade certain properties. Room temperature allows optimal absorption. Then, add the juice of half a fresh lemon. The vitamin C and citric acid enhance magnesium absorption through a process called chelation. Lemon also makes the drink more pleasant. Fresh lemon is always better than bottled juice. Finally, you may add 1 teaspoon of raw honey if desired. This is optional. Honey provides trace minerals that support electrolyte balance and improves taste. If you're diabetic, you can skip it. To prepare the drink, pour the water into a glass, not plastic. Add the magnesium citrate powder and stir vigorously until fully dissolved. You should not see residue at the bottom. Add the lemon juice, then the honey if using it, and stir again. The drink should appear slightly cloudy. Critical is timing. Drink this 2 to 3 hours before bedtime. Magnesium takes about 2 hours to reach peak levels in your bloodstream. You want those levels elevated when you're sleeping because that's when cramps usually occur. Sip it slowly over 5 to 10 minutes. Consistency matters more than anything. You need to drink this every night for at least 2 weeks. Some people notice improvement within days, but your body needs time to rebuild depleted magnesium stores. Magnesium works by stabilizing nerve signaling. Nerves communicate with muscles through electrical impulses. Magnesium regulates calcium and potassium flow in and out of cells, preventing nerves from misfiring during rest. When magnesium is low, nerves become hyperexcitable, especially at night. Magnesium citrate is bound to citric acid, which makes it bioavailable. Your body can actually use it. This is why people often say magnesium didn't work for them. They were taking the wrong form. Now let's talk safety. If you have kidney disease or impaired kidney function, you must speak with your doctor before taking magnesium. The kidneys regulate magnesium levels. If they aren't working properly, magnesium can accumulate to dangerous levels. If you experience loose stools, reduce the dose to 200 milligrams and increase slowly. You can strengthen results by eating magnesium-rich foods during the day. Dark chocolate with 70% cocoa contains magnesium. Almonds and cashews are excellent sources. Cooked spinach and leafy greens provide significant amounts. Avocados offer magnesium along with potassium. Fatty fish like salmon support muscle health. Legumes, whole grains, and bananas contribute as well. Other factors can worsen cramps. Dehydration is a major one. As we age, thirst signals weaken. Aim for 6 to 8 glasses of water daily. Cold temperatures can trigger muscle contraction. Keep your legs warm at night. Poor circulation contributes as well. Gentle movement, leg elevation, and compression stockings during the day can help. Certain medications, especially statins, may worsen muscle symptoms. Never stop medications without consulting your doctor, but do discuss side effects. Stretching before bed helps keep muscles flexible. 5 minutes of gentle calf stretching can make a difference. Here's what to expect. Night 1 may show little change. Days 2 through 5 usually bring fewer or less severe cramps. By week 2, many people report sleeping through the night. If cramps persist beyond 4 weeks, consult your doctor to rule out other conditions. This isn't masking pain, it's restoring proper muscle function. I know how exhausting broken sleep can be. I know how it affects mood, energy, and quality of life. But you do not have to accept this as normal aging. Your body is asking for support, and this is how you give it. 2 minutes tonight could change your sleep, your energy, and your days. Commit to 2 weeks. Track your progress. Be patient with your body. Peaceful, uninterrupted sleep is possible again. If this guidance helped you, subscribe to the channel for medically grounded, honest senior health advice, and share this with someone who deserves peaceful, pain-free sleep again.